Hello, everyone, and welcome to SoftFil Academy's webinar. We are very happy to welcome all of you. And of course, very honored to have Dr. Sezgin with us. It is the first time that you are doing a webinar with SoftFil Academy. So thank you so much for being here.
Thank you so much. It's my pleasure, Hannah. I'm very excited to be here among all of you. Have a lovely webinar. Hopefully, we're all going to have a lovely webinar together.
Yes.
Let me just go ahead and, okay.
So tonight's theme is focused on micro-cannula injection on the tear trough. So it's a very interesting theme that a lot of you have been requesting over the months. And we are very excited to hear Dr. Billur's teaching on this theme. I wanted to introduce to you the webinar with saying that the presentation is going to last 35 minutes, 40 minutes, and please don't hesitate to ask your questions during the webinar in the chat or in the Q&A section, but we will answer all of the questions at the end of the presentation. Also note that the webinar is being recorded and it will be available to you from tomorrow on SoftFil Academy's website and on our YouTube page. We have started to subtitle all of our webinars, so it will be available to you in English, but with also French subtitles, Spanish and German subtitles, so that as many of you can try to understand the webinar. So I will introduce a bit more about Dr. Sezgin, who is a plastic surgeon from Turkey. She is educated both in the US and in Turkey, where she graduated with the highest degree in Ankara University School of Medicine. She is a specialist and associate professor at Koç University School of Medicine in Istanbul, as well as a member of the Committee on Scientific Research. She's a representative of Turkey in the American Society of Plastic Surgeons and a fellow of the American College of Surgeons. Dr. Sezgin has published numerous articles in national and international books and journals, and she's an international speaker and trainer in various congresses, conferences, and society meetings. And of course, she's a SoftFil Academy expert, and we're very proud to have her among our team. So we can now start the webinar. Dr. Sezgin, you can go ahead with your presentation. Thank you again so much for everyone to be connected, and I hope you can learn as much as possible tonight. Thank you.
Thank you so much, Hannah, for the beautiful introduction. Once again, hello, everyone. Good evening from Istanbul, wherever you are in the world. I'm very happy to be sharing with you my approach to the tear trough deformity using micro-cannulas, mainly SoftFil micro-cannulas. So among my disclosures, Hannah did mention, I am an international key opinion leader for SoftFil, as well as for the filler company Teoxan. And I'm also a national advisory board member for Saltek, which is the Turkish distributor of both SoftFil and Teoxan in Turkey. So without further ado, let's get started. We are currently living in an era where any kind of application that can enhance our beauty or attractiveness is very highly requested. And this is mainly due to the increase in social media, the effect of filters, Instagram, selfies, FaceTime, webinars. So with all of this, of course, there is always a search to seek the most youthful, the most beautiful version of ourselves. And of course, when we talk about enhancing features, there are different features that we can enhance. We can enhance our mid-face, we can enhance our lips, we can enhance our periorbital area. And when we look at all of these areas, one of the areas that I think we have to focus very, very specifically on is the periorbital area, meaning the eye region. The reason for this is because there is actually a proverb or a saying by William Shakespeare, and it's that the eyes are the window to the soul. And this is very true because when you look at a person's eyes, you can definitely tell how they're feeling, their emotions, their state of restedness, if they're tired, if they're rested, if they're energetic. So the eyes really tell a lot about a person. It actually gives a very big first impression. Therefore, people want to have eyes and the periorbital area look very fresh and very youthful, because this definitely provides a very important aspect to the full balance of the face. I would like to share a small example for this when I'm starting this presentation. And this is an example from one of my patients. This lovely patient, she is 43 years old, and she came to me because she said, well, she actually wanted to do some procedures. She wanted to look more youthful. She wanted to look more fresh. And she said she was always postponing this because she couldn't find the time, and she never had done anything. Until one day, her daughter had a school project, and they asked her to draw the members of the family. And she said that she saw her daughter's project. And in the project, the daughter said that her mom always had purple bags under her eyes, and she even drew them in the picture. So when the mother saw this, she said, even my 9-year-old girl can actually look at this and say, I need to do something about my under eye. So she ran to me and she showed me this. She said, this is how I had my calling, and I decided that I needed to have something done to my under eye circles. So with this, of course, our patients have many expectations. As mentioned, if they are young, they want to look more attractive, more beautiful, whereas when they get older, they're actually seeking what they've lost. They want to be more youthful. They want to look the way they did maybe 10 years ago, 5 years ago. So it's actually a spectrum of different things that they might want. And it's very important for us to understand this by questioning it when they first come to us for a consultation. But of course, with these expectations, we also see several concerns that our patients can address. And these concerns mainly deal with certain stereotypes that are caused by these treatments. For example, having a deformed face, or a very typical done-up face, or a pillow face where it looks overfilled, because patients really don't want to look like this way. They want to look natural, and they want to look like themselves. But they look at social media, or they look at celebrities, and they say, okay, so the celebrity actually has all of the abilities to find the best doctor. They have the ability to purchase the highest quality product, but still they can look bad. And this is what they really fear. And we see examples of this day to day. For example, here's a picture of Madonna before and after, I would say, unfortunately overfilled a mid-face and also the under eye area. So looking at this patient, say, I do not want to look like this. And it's very normal because we always have to keep in mind the patient's normal structure and their normal anatomy. And we have to respect this and provide treatments that respect the normal features of our patient, each and every single patient, whether it's a male, it's a female, it's an old patient, a young patient. So we have to take into consideration their personal characteristics. But whatever the age, even whatever the gender, I would say, the under eye circles are definitely a major concern for the population. When we look at a study that was done in the population of patients who wanted to get filler treatments, we saw that approximately the second concern for every single treatment in the face was the under eye area, the tear trough deformity for patients in their 30s. And it was the third highest concern for patients in their 60s. So you can see that even for young patients and even for old patients, it's just one of the major aesthetic concerns that women and all patients really can face throughout their lifetime. And while we do this, of course, we have to be able to provide cutting edge, high quality, and very good harmonious results. For this, we have to make sure that we are creating safe results with minimizing the risk of adverse events, because this can also be seen in the under eye area. You can see infections, you can see swelling such as this, and this is something that we have to avoid. And of course, as clinicians, as doctors who are performing these procedures, we need to be able to have a good amount of knowledge in order to execute this treatment properly. In order to do this, we have to know three things. We have to know the anatomy of this area. We have to know the correct techniques that we have to use in this area with safety in mind. And finally, we have to be able to know about the products that we can use in this area, both filler and also the instruments for injection that will provide us with the safest and most balanced results. So in general, this is what I'm going to talk about. This will be the outline of my presentation. I will talk a little bit about the anatomy, the techniques, and the products that we can use to have a nice refined technique to the tear trough deformity. because our motto is that a safe and optimal filler procedure will ultimately depend on the right product at the right places with the right techniques. So let's go into anatomy. First of all, let's talk a little bit about the under eye circle and what we define as the under eye circle. The medial area of the under eye circle, as you can see here, is called the tear trough. So the tear trough is actually the medial border of the under eye circle. This can actually extend to the lateral area as the lid-cheek junction, and this is called the palpebromalar groove. And sometimes there is an additional groove underneath the tear trough, another depression, that's called the nasojugal groove. And this is actually in continuation with the mid-cheek groove, like this. So we can actually see this deformity, the tear trough, in children, and we can also see them in aging people as well, because it can actually be congenital, meaning it can actually be caused by a hereditary structure of the bone in that area, or it can actually increase with age as the aging process continues and the tissues start to lose elasticity. So aging is the main cause of these under eye circles, but we can say that, of course, lifestyle and also genetics play an important role in this as well. So anatomically speaking, of course, I'm going to go into this with a lot of detail, but we have a structure called the tear trough ligament. And this is actually an area where the orbicularis oculi muscle directly contacts the orbital rim, the bone, the bare bone. So in this area, there's basically no deep fat tissue, hardly any fat tissue at all. It's just the skin, the muscle, and then the bone. And where this ligament is sticking onto the bone, the muscle, this is where we have the tear trough. If this extends laterally to the cheek junction, as we mentioned, it's called the palpebromalar groove. Here we do have a deep fat pad, as you know. It's called the SoftFil, or the suborbicularis oculi fat pad. So here we actually have a 5-layer anatomical dissection. And this is important for us because when we are treating, we have to know which layers we have to treat. And I will go into this detail in a few slides. So looking at the tear trough, the under eye region, basically, in the lateral region, as we mentioned, we have 5 layers. So the 5 layers that we see are the skin, which is very thin, of course, in this region. Then we have the infraorbital fat compartment. This is very important because we have lots of people who can have some under eye swelling, in general, just edema in this region. And this is usually the area that actually creates this edema. Underneath this, we have the orbicularis oculi muscle, which is the muscle that surrounds our eyes. And then underneath the orbicularis oculi muscle, we have the SoftFil, the deep fat pads. And underneath that, we have the periosteum, the bone. So you can see these numbered 1 through 5. And this is the lateral area. When we go medial to the tear trough, this is where we have the 3-layer anatomy. So we have the skin. The skin might have just a very tiny layer of fat, but in general, there's hardly any fat in this area because it's very, very, very thin. And then we have the orbicularis oculi muscle. And as I mentioned, it is directly stuck onto the bone, onto the orbital rim. So it is a 3-layer area in the medial portion of the midpupillary line. So what are the different things that we have to take into consideration besides the layers? We have to know about the danger zones and the difficult areas that are actually connected to the tear trough. We know that, first of all, there are some vascular structures here that we have to be very cautious about. The main artery that supplies the face is the facial artery. And here you can see the facial artery exiting in front of the premasseteric ligament, in front of the masseter. This is actually exiting in a deep way, meaning it's underneath the platysma. And then the facial artery actually goes in an oblique course where it actually goes underneath the zygomaticus muscle, approximately, here you can see underneath the zygomaticus muscle, about 1 centimeter lateral to the commissure. And here in the nasolabial fold, it actually has a superficial course. Once it hits the alar base, it follows a subcutaneous path, so it's still very superficial, until it ends at the top here as the angular artery. It's the terminal branch. But of course, even though it's a terminal branch, the face has a very complex circuit when it comes to the vascular structures. When we look at the vascular structures, you can see here that we have 2 systems that are supplying the face. We have the external carotid system, which is basically what the facial artery is derived from. It's the branch of the external carotid system. And we also have the internal carotid system. And here you can see close to the eye, we have two different branches that supply the forehead and the glabella. These are the supraorbital arteries and the supratrochlear arteries.